Hi, my name is Molly Wawro, and I'm a nursing student at the VA Hospital's CLC, and I'm going to present a patient to you right now. Patient is an 84-year-old married Caucasian male. Patient's former job was as the director of a YMCA. Patient is being treated for multiple myeloma. In April of 2014, patient had a colonoscopy at Beaumont Hospital where he was diagnosed with aplastic anemia. Patient was then diagnosed with stage 2 multiple myeloma. Patient was given 2 units of blood transfusion every other week. After the transfusions, patient would feel fatigue for 2 days, and by the third day would feel back at his normal energy level. Patient weakness was a sign of a low blood count. In January of 2015, patient became dizzy and fell outside of his car and became unconscious. Patient was transported to Beaumont Hospital, where a CT scan was taken. Patient's cancer had progressed to stage 3 with amyloids in 2/3 of his organs. The doctor gave the patient 7 months to live. Patient is currently in his 3rd month. Patient goes to rehab for physical therapy but is fully dependent on nurses and his wife for all daily activities. Sleeping in a recliner instead of a bed sometimes alleviates the patient's pain. Patient reports having pain in his legs and restless leg syndrome at night. Patient's usual pain is an 8 on a 0 to 10 pain scale. Since the cancer diagnosis, patient has lost 50 plus pounds. Patient reports frequent constipation and loss of appetite. Patient's vital signs are as follows. Blood pressure is 112/62, pulse is 90 beats per minute, patient has 12 respirations per minute, temperature is 36.8 degrees Celsius taken orally, and oxygen saturation is 97% on room air. Health history. Patient reports no childhood illnesses or history of chronic or serious physical or psychological illnesses. Patient reports being up to date on all immunizations and reports having regular, routine checkups with his primary doctor. Patient is allergic to penicillin. The patient is currently on no medication, but instead is being treated with palliative care to remain comfortable and is receiving training to deal with his probable death in the future. Hospitalizations and surgeries. In 1962, patient was hospitalized for inguinal hernia open surgery for 5 days. In 1973, patient was transported to the hospital for an emergency appendectomy after his appendix ruptured. Patient was hospitalized in 2013 for neck surgery after a fall in his home left him temporarily disabled. Patient was hospitalized in January 2015 for his multiple myeloma and is currently being supervised by round-the-clock nurses at his home. Functional assessment. Patient reports being a social drinker and being a light smoker for 20 years. Patient was an avid golfer and runner before his diagnosis. Patient reports using a sleep machine to help with his sleep apnea. Patient reports eating a healthy diet and drinking 2 medium-sized cups of coffee each morning. Patient used a cane for stability and reports having hyperopia in both eyes. Psychosocial data. Patient reports having several family stressors over the years, such as living away from his children. Patient currently lives in Lansing, Michigan with his wife. Patient reports having good relationships with friends in the senior community where he lives. Patient reports being very spiritual and identifies as a strict Lutheran. Patient reports feeling stressed by his Parkinson's disease, as sometimes it has caused him to need help eating or buttoning his shirt over the years. Family history. Patient reports that both his mother and his father had high blood pressure. His mother was diagnosed with Parkinson's disease at age 60. No report of cancer on either maternal or paternal sides. Patient is an only child. Review of systems, musculoskeletal. Due to the multiple myeloma that has affected the patient's activities of daily living, such as not being able to stand, it's important to assess his musculoskeletal system. Patient reports numerous chronic joint pains in his knees and his shoulder. Patient reports no edema, arrhythmia, warmth, or deformities. Patient reports having severe limitations in all ranges of motion. Patient reports having severe limitations in performing daily activities and reports needing round-the-clock care from nurses and his wife. Patient reports feeling very weak and being unable to sometimes not be able to lift his hand. Patient reports weakness in all body areas. Patient denies having any history of arthritis. Physical assessment, musculoskeletal. Due to the patient's major weight loss and statement of feeling weak all over his body, it is important to assess his range of motion in all joints for competency. Upon inspection and palpation, patient's muscle mass and bone structure appears below average for an 84-year-old overweight male. Muscles are symmetrical in shape, but not in size. Upon inspection with assistance, patient's posture is slouched instead of erect, and patient has a Parkinsonian gait in which he can only make small shuffling steps. Upon palpation, there is no signs of scoliosis. Upon assessment and palpation, patient is unable to perform range of motion in his shoulders, the ball and socket joint, hips, knees, and spine. Patient denies any arrhythmia, inflammation, warmth, or crepitus in these joints, but is unable to perform their range of motion due to having a 7 on a 0 to 10 pain scale in these joints and feeling weak. Patient is unable to perform a full range of motion in his elbows. He is unable to flex his elbow a full 150 degrees. Patient reports having pain when flexing his elbow. Patient is able to perform range of motion in his wrists, both for supination and pronation. Patient can perform full range of motion in his wrist, hands, and fingers. Patient is able to perform full range of motion in his TMJ and neck. Patient reports no arrhythmia, inflammation, warmth, or crepitus in those joints and only mild pain. Patient has limited range of motion in his ankles as he cannot hyperextend his ankle. Patient reports pain when trying to hyperextend his ankle. Muscle strength in patient's deltoids, biceps, triceps, hip, hamstrings, and quadriceps is graded as a 0 as he is unable to lift those joints. Patient's muscle strength in his wrists and fingers is graded as a 5, and patient's muscle strength in his ankles is graded as a 2. Review of systems, peripheral vascular. Due to the patient's statement of feeling severe weakness in all parts of his legs, it's important to inspect whether there are any other medical problems with his legs, such as edema or blood clots. Patient reports having a grade 7 pain on a 0 to 10 scale in all parts of his legs while walking. Patient uses a walker and medical professionals for assistance walking. Patient denies any edema, coolness, or hair loss on both his upper and lower extremities. Patient denies any history of blood clots in his legs and denies having varicose veins. Physical assessment, peripheral vascular. Upon inspection of the patient's lower extremities, patient shows no signs of discoloration, varicosities, uneven hair distribution, edema, or ulcers. Upon palpation of patient's temporal, carotid, brachial, radial, femoral, popliteal, posterior tibialis, and dorsalis pedis pulse, patient exhibits a pulse of a 3+ on a 0 to 4+ scale. Upon palpating the patient's fingers and toes for a capillary refill, patient shows normal capillary refill results of less than 2 seconds to gain normal pink color back. Pertinent systems number 1, gastrointestinal. Patient complains of chronic constipation, most likely due to his inability to exercise. According to the journal from the American Board of Medicine on chronic constipation, there is a link between exercising and a reduced risk for chronic constipation by stimulating a bowel movement. Given my patient's ailing health and inability to exercise or even walk independently, it is important for the patient to be moving as much as physically possible with assistance in order to stimulate a bowel movement and relieve his chronic constipation. This assessment is related to the other system assessments done on the patient, specifically the peripheral vascular assessment. Due to the patient's pain and weakness in his legs while walking, the patient may not be able to walk very much, if at all, which would then further his chronic constipation. Pertinent systems number 2, head, ears, eyes, nose, and throat. Patient complains of dizziness, especially when walking. According to a medical journal published by the Annals of Family Medicine, a study was done to identify major contributors to dizziness in the elderly. Some major contributors were cardiovascular disease and an adverse drug effect. Although the patient denies having either of these problems, the journal brings out that dizziness is common among elderly people. 30% of people over the age of 65 experience some form of dizziness. Due to my patient's age and his overall bodily weakness due to his cancer, the patient may experience some form of dizziness. It is important that when the patient is standing and or walking, that he constantly has someone with him in order to prevent a fall. Therefore, it is also important to perform a head, ears, eyes, nose, and throat exam on my patient.